So as Chad said, my name is Jennifer Campbell. I'm a Senior Advisor here at EIHR in the Platforms and Major Initiatives branch, and I'll be one of the presenters today along with Dr. John Lavis, who is the Director of the McMaster Forum and Professor of the Department of Clinical Epidemiology and Biostatistics at McMaster University. So in terms of the agenda today on the webinar, we'll be providing background on the EIHR portal and give you a sense of how and why it was created and by who, as well as what is in it. There will be a live demonstration by Dr. John Lavis to provide you with practical information on how to use the portal. There will also be time at the end of the webinar for questions and answers and discussion. Before we begin, we'd like to do a quick survey to get a sense of who is on the call. And so if you could answer the two questions when the poll appears on your screen. How would you classify yourself in terms of your position? And also, in what geographical area are you located? We'll just give a moment for everyone to do that. And this just gives us a sense of who has joined us on the call. Okay, we're having some technical issues with the polling, so we'll move along. Okay, so I just want to set the stage a little bit and give some context for this EIHR Portal initiative. So back in 2010, EIHR launched one of its 8 roadmap signature initiatives, which focused on mobilizing rapid and robust research that responds to policymakers' evidence needs on important topics of healthcare renewal in Canada. This initiative, called the Evidence-Informed Healthcare Renewal, also referred to as EIHR, focuses on financing and funding models, health system sustainability, and governance and accountability of Canada's healthcare systems. Issues that continue to top the agendas of government officials, health system managers, and the public. The EIHR Signature Initiative was designed to fund policy-relevant research that will help governments to make evidence-informed decisions about healthcare renewal in Canada and aims to do this in a timely way. A number of different funding opportunities to support things like knowledge syntheses, policy analysis, and other project funding have been launched to date, and projects are now underway. For more information about the Evidence-Informed Healthcare Renewal Initiative, you can visit our website, and the link for that will appear on your screen in the chat box. So in addition, as part of this initiative, with the goal of coordinating efforts with other organizations, EIHR convened organizations working in the area of healthcare renewal. And one of the outcomes of this meeting with other organizations was to a clear need for a common access point for healthcare renewal related evidence. And work began following this EIHR roundtable meeting in October 2011, and different options were explored for doing this. And so the EIHR portal is what resulted. Our vision for the EIHR portal was to be the premier site for linking policymakers and other stakeholders with information on healthcare system renewal and transformation, and that it become a reliable go-to tool for stakeholders to access evidence. With the support of many organizations and the stellar work of Dr. Lavis and his team at McMaster to set up the portal, I'm pleased to say that the vision has become a reality, and the EIHR portal has been in place now since June of last year. And so it is open to the public and available to use. We see this as having enormous potential to support decision-making and also as a mechanism for linkage and exchange across jurisdictions related to health system innovations. The portal is managed through a collaboration between McMaster Health Forum and the EIHR, and 19 organizations from the EIHR Roundtable contribute documents to the portal and have provided financial support to make the portal possible. As you can see, the coming together of such diverse organizations to achieve this speaks to the need for this portal from many different perspectives. Provincial funding agencies, health organizations, professional associations, federal and provincial and territorial ministries have all come together through the EIHR Roundtable to make this portal a reality. As outlined previously, the EIHR Portal is housed at McMaster's Health Systems Evidence Site, and Dr. Lavis and his team have worked closely to set up the parameters for inclusion of documents in the portal and to set up the functionality. I would now like to turn things over to Dr. John Lavis to provide more specific information about the portal and to do a live demonstration of how the portal functions.
Thanks very much, Jennifer. The audio was a bit of a challenge, but it suddenly improved dramatically. Chad, can you just confirm that you can hear me okay?
Yes, we can.
Great. Thank you very much. So thank you very much for the introduction, Jennifer. And as Jennifer mentioned, it's because of a partnership with CIHR and 19 organizations across the country that we were able to do this. It's been a delightful collaboration. Two of my colleagues from the team here are also on the webinar, Carolina Kowalewski, who's currently in Calgary, and François Perrovin, who's based in Quebec City. So I'm presenting, but there's a team of many behind this. I'd like to just talk briefly about what is the EIHR portal. As Jennifer alluded to, the goal of the EIHR Roundtable members was to establish Canada's most comprehensive free access point for policy relevant documents. And they specifically wanted documents that would support policymakers, stakeholders, and researchers who are interested in how to strengthen or reform health systems, or as some people might put it, how to get cost-effective programs, services, and drugs to those who need them. And in the roughly 1 year since it's been operating, we feel we've made tremendous progress, and the portal is now filled with documents particularly comprehensive from 2003, which was the date of the first accord, up until the present. And every month, we're regularly updating through a very rigorous process that's led by Carolina, any new documents that are published. The portal, again, as Jennifer mentioned, is integrated within health systems evidence to provide a single point of access to the ever-growing body of evidence related directly and indirectly to healthcare renewal. So as I'll be showing you in a few minutes, one of the advantages of that integration is that if you search the EIHR portal because you were, for example, very interested in how to strengthen primary care within a given province or territory, and you pulled up a very, very helpful strategic document that had been produced by a given Ministry of Health, you would then be prompted to say, would you like to see any related systematic reviews of the research evidence on this topic? Would you like to see any economic evaluations on this topic? So it's in one place providing people with both the policy relevant documents and the best available research evidence in the world on those topics. So all of the systematic reviews in the world related to strengthening health systems are in health systems evidence, all of the economic evaluations, and so on. Currently, at least as of a week or two ago when we finalized this slide deck, there were 950 users enabling EIHR portal content. In fact, if you're accessing the portal from anywhere in Canada, you don't need to enable the content. It automatically detects that you're coming from an IP address based in Canada and presents the portal to you. However, if you're outside the country, and so coming from an IP address outside of Canada, then you need to enable the content so it is viewable. And this was done simply so as to not confuse our partners in other parts of the world who routinely use health systems evidence and might have become confused if there was a portal that was specific to Canada in what is otherwise a global resource. But we have 950 users around the world who have chosen to enable that content. 247 of them are policymakers, 146 of them are managers, and then you'll see the remaining distribution of people who've enabled the content. 470 users have signed up to receive the EIHR Customizable Evidence Service. So this means once a month, they're notified about any documents that have been added to the portal in their area of interest. They can either choose to select all additions, and typically we're adding about 50 per month, or they can choose to receive them only in defined areas of interest. So I'm sitting in a territorial Ministry of Health, and I'm particularly focused on mental health. I can choose to only receive documents added to the portal in the area of mental health. Or as I mentioned before, I can choose to receive all of them at the moment. The types of documents that are in the portal are quite diverse. I'll show you the full list in a few minutes when I do the live demonstration, but there are documents like jurisdictional reviews. So if someone has looked to see how a selection of provinces and territories have tackled a policy issue, you would find that type of document. Toolkits to, for example, undertake reform in primary care would be in the portal. Guidance, so if groups have come up with particular forms of guidance related to strengthening or renewing healthcare reform, and so on. Citizen and patient input, stakeholder position paper, for example, a report produced by the Canadian Nurses Association. We've just recently added one new type of document, which is political party platforms, which we do for the political party that ended up forming the government. So in British Columbia, for example, the political party platform for the Liberal Party, who was just re-elected, would be identified and put into the portal so that you have a good sense about where the recently elected government is planning to go in terms of healthcare, and so on. You'll also see intergovernmental accords, government strategic plans, and 17 other types of documents. These documents address priority areas identified by Canadian federal, provincial, and territorial governments. So we identified the priority areas that were named in the 2003 and 2004 accords and coded all of the contents of the EIHR portal in relation to those priority areas. If you scan the few examples that we have on this page, primary health care, patient safety, health human resources, performance indicators, you'll see that these are quite timeless issues that remain as salient today as they did a decade ago. And there are 12 other priority areas. And again, when I get to the live demonstration, you'll have a chance to see what the full list can look like. The EIHR portal is searchable in both official languages. So you can either turn the interface to French or to English, and I'll demonstrate that in a second. When you conduct a search, it functions very much like Google in the sense that you can just go in and type in a search term, and it then has a very powerful synonyms dictionary. So if you were to enter pay for performance, that would be mapped to synonyms that other people might use for the same concept. So some people might call that results-based financing. So any document using that different term would also be retrieved by your search.
Hi, John. Sorry, apologies to cut through someone. Douglas is asking, what are the other 12 priorities areas?
Yep. So I'll actually come to that in a minute. I don't have them off the top of my head, but when I come to the live demonstration, I'll be able to show what the other 12 are. So my apologies that I can't recite them.
Excellent. Thank you.
The advanced search also allows you to use the same fields as you can use in health systems evidence. So if you feel constrained by the options available in the portal, you can also use the fields available in health systems evidence more generally. And you can choose to search by policy document type, for example, restricting it to jurisdictional reviews, priority areas, for example, restricting it to mental health, or by jurisdiction. If you only want to see what is happening in Alberta and Saskatchewan, you can restrict your search to those two jurisdictions. I mentioned before the customizable evidence service. So it's a free service that people can sign up for. Once a month, you would receive an email that contains links to any documents in your area of interest, or if you choose, every document added to the portal in that last month. We also have a list of additional resources that are available for download from the EIHR portal. So we have a listing of videos and podcasts that are directly related to healthcare renewal. Many of them are available in both English and French. I'll be showing you that document very shortly. We also have series for which only the most recent version can be found in health systems evidence. So an example would be the Canadian Institute of Health Information routinely puts out annual documents in particular domains. So say a review of the current status of health human resources across the country. The current EIHR portal would contain the 2012 or 13 document, whichever is the most recent year in which it was produced. However, links to all of the preceding years is available as an additional resource. So you can go to this additional PDF and find the 2011, 10, 2009, and so on version of the same document. We also point people towards other online databases that complement the EIHR portal. And again, I'll show you all of this in a minute when we come to the live demonstration. So these are some scenarios that the portal can help you with. So imagine a ministerial task force urgently needs information about public opinion and stakeholder positions regarding timely access to care. A quick search of the EIHR portal, specifically focused on the document types of citizen input or stakeholder input, would pull up this type of information. Scenario 2, a regional health authority seeks frameworks and toolkits about suicide prevention in Aboriginal communities. So frameworks and toolkits are two of the document types contained in the EIHR portal, and you could enter suicide prevention and you could enter Aboriginal in the open search term and quickly combine those searches and then end up with frameworks and toolkits specifically about suicide prevention in Aboriginal communities. Scenario 3, a graduate student needs to identify key policy relevant documents about recent intergovernmental health accords. Again, if that doctoral student went to the EIHR portal, intergovernmental health accords are a particular type of document. They could tick on that and immediately retrieve any that are in the database, which should be comprehensive from 2003 to the present day. So why use it? Well, the EIHR portal can save precious time by helping users to rapidly identify documents on a given topic that have been prepared to inform healthcare renewal in Canada. We also provide information about how recently the document was published, so you have an immediate sense of how recent the data contained in it is. We provide links to user-friendly summaries and full-text reports where that's applicable. In virtually every instance of a document being in the EIHR portal, we do have a link to the full-text reports. However, not all of the documents would have a separate link to a user-friendly summary, but where one exists, it would be provided. Also allows you to look at any related documents, including health systems evidence. So I mentioned before, if you find, say, a jurisdictional review on a topic that's directly relevant to your interest, you would be prompted to say, would you like to see a systematic review or economic evaluations on the same topic? Jurisdictional reviews are very good for telling you what other provinces and territories are doing, but the systematic reviews and economic evaluations are needed to tell you whether what they seem to be doing is actually effective and is it cost effective. I'm not sure, Chad, was the problem with the survey sorted out? Are we able to do a quick poll?
So what I'll be doing is I'll put myself as a presenter and then I'll be able to launch the poll from here.
Great.
So did you want to provide some background on the survey that we're taking?
Absolutely, sure. So the first question is about whether you're already registered on the Health Systems Evidence site. So in order to access the EIHR portal, you have to fill out a very brief, it takes seconds, a very brief registration process for Health Systems Evidence. So if you have previously conducted searches of the EIHR portal or Health Systems Evidence, you would be registered. So if you don't mind ticking yes if the answer is you previously have registered. So if you've used the EIHR portal before or Health Systems Evidence, you would be registered, and if not, then just put no. Then the second question is, have you signed up to receive a monthly evidence service containing new additions to the EIHR portal? Unless you signed up since the end of, we're currently in June, unless you signed up since the end of May, this would mean that you will have been receiving at the end of every month an email containing a list of documents with hyperlinks to the record that have been added to the portal in the last month. So if you've asked to receive the evidence service in the last couple of weeks, then you would tick yes. If you've received this anytime on a monthly basis over the last while, then you're clearly signed up and you would put yes. But if you have not signed up on Health Systems Evidence, then you would put no. So it seems that about 20% of you are registered in Health Systems Evidence, about 55% of you are not registered, and then about 24% of you didn't answer. And in terms of signing up to receive the evidence service, the majority of you have not. So about 2/3 of you, 67%, have not signed up to receive the evidence service. So I would encourage you to, if you want to take advantage of the very significant amount of resources in the portal and to be notified about any new additions to it, that you consider registering and signing up to receive the evidence service. And I'll be showing you how to do that very shortly. So thank you very much for participating in the poll. And thanks, Chad, for passing back the reins to me. So I'm now going to give a live demonstration of the portal. So I'm going to share my desktop. So
we can see it.
Excellent. So if you were to type in EIHRportal.org, this is the interface that you would be taken to. So this is the EIHR Portal homepage. As you can see, you have a choice between entering the portal through the English interface or through the French interface. If you would like to know more about the portal, you can just click on the link, and there's a description about what's contained in the portal and a listing of the organizations that contribute to the portal. If I jump back to the EIHR portal, if I were to now click English, I would be taken to, whoops, I thought I was going to be able to do a shortcut, but no, so I'll have to sign in myself. So I will just enter a temporary password so that you see the same interface one day if you register as I do. Hopefully I've got it right. It's not my usual one. Yes. So that would be how people who have already registered for Health Systems Evidence enter it. If you haven't registered, just above where I entered my ID and password, there is an option for registration. So let me show you what you would get if you went to that page. Once you're in Health Systems Evidence, you can also update your profile by clicking in the top corner, Update My Profile. So this is the page that you would come to either register or to update your profile. So all you need to do is enter your email address, a password, your preferred language, which can be English or French, Canada as your country of residence, assuming that most of you are currently based in Canada, and you would pick your role. So those are the only bits of information that we collect, so we know whether our users are primarily Anglophones or Francophones, what country they're from, and what role they play. And then within interests, this is where you would enable viewing of complementary content. I mentioned before this is not necessary for Canadians who are accessing the site from a Canadian IP address, but if you anticipate being outside the country during periods where you might want to access the EIHR portal, then you would tick here. If you would like to receive the evidence service, then you would tick here. So yes, I would like to receive the monthly evidence service. But to tell the system which documents you would like to receive, you would click on Canada's EIHR portal, and you can either choose to receive every document, or you can choose to receive very particular ones. So I might be only interested in receiving documents that are jurisdictional reviews, frameworks, and toolkits, or it could be that I only want to receive documents that are about primary health care. So there are currently 268 documents about primary health care in the portal. Every month, a small number would be added. If I had ticked primary health care and yes, I would like to receive the evidence service, then once a month, I would receive any new documents of that type. So that's how you sign up to receive the EIHR monthly evidence service. If I now go back to the home page, you'll see down here Canada's Evidence-Informed Healthcare Renewal Portal. So you can click on why use it and who's behind it, where you'll get the same document that you would have got on the original EIHR portal page, again describing what's in the document and who's behind it. I can also click on a separate document or a separate link, and it's called What's in It. So if I'm not sure what is meant by performance review, for example, I could come here and I could read the definition. If I'm not sure what is meant by a government strategic plan for the health sector, I could come down and read what's here. So this is a description of the types of documents in the portal. I can also click on a two-page backgrounder. So if I want to read a little bit more about health systems evidence and know exactly what it's about, I can come to this page. And I can print this out as a reminder about how it works, and I can share it with colleagues as well. And the final option, second to last option, is additional resources to support healthcare renewal. So if I were to click on that, I would end up with a document that looks like this. So on the left side, additional resources to support healthcare renewal in Canada. On the right-hand side, the French translation of that text. The first of the types of documents in this, or records in this document, are videos and podcasts that address the same national priority areas as are contained in the EIHR portal. So if I was interested in how Canadian primary care physicians rate the healthcare system, I could go to this link to a podcast produced by the Health Council of Canada. So it's a very helpful resource listing of videos and podcasts related to healthcare renewal. The second type of document that's in this additional resources is documents for which only the most recent issue in the series is in the searchable EIHR portal. So the Alberta Health and Wellness Annual Report for 2010 to 11 is contained in the EIHR portal. However, if I had a reason for wanting to go back to see the 2008 report, I could come here and click on the link and be brought directly to the 2007-8 version of the report. So the X here indicates that the most recent version is in the EIHR portal, and these X's indicate that they're no longer in the portal because they're not the most recent version, but I can access any of them very quickly. So for those of you who are looking for historical documents, especially of series, this can be very helpful. The final piece of this additional resources document is a listing of other searchable databases that complement the EIHR portal. So if you're unclear about where to go for what question, this one-pager tries to explain it. So if I want policy-relevant documents about healthcare renewal in Canada, the place to go is the EIHR portal. On the other hand, if I wanted systematic reviews and economic evaluations about healthcare renewal, then health systems evidence would be the place to go. But as I'll show you in a minute, by searching one, you're also searching the other. However, if I wanted to know about the effectiveness and cost-effectiveness of clinical programs and services, I would go to the Cochrane Library. If I wanted to know about the effectiveness of public health programs and services, so services targeted at groups and populations rather than individuals, I would go to healthevidence.ca. If I wanted to know more about the effectiveness of implementation strategies targeted at consumers or providers, I could go to RX for Change. If I wanted descriptions of innovative healthcare practices, policies, programs, and services identified as having the potential to strengthen Canada's health system, I could go to the Health Council of Canada's Health Innovation Portal. And finally, if I wanted alerts, advisories, and recommendations to improve quality and patient safety, I could go to Global Patient Safety Alerts, which is hosted by the Canadian Patient Safety Initiative. So if I'm a busy policymaker or stakeholder, very keen to use the most recent available evidence and policy-relevant documents, this is the map of the different places I go depending on the question. But if your question is about healthcare renewal, then everything that you need would be in the EIHR portal or health systems evidence within which the EIHR portal is hosted. So if I go back to health systems evidence, that was what I would get if I went to additional resources. If I were to click on video tutorial, I would be able to watch a short video about the EIHR portal. So if your colleague wasn't able to attend today's webinar, wants to know a bit more, they could go to the video tutorial. So now if I want to do a search, I can either do the search from up here. I could enter any term that I wanted, like primary care, or I could go directly to the portal. So here are the national priority areas. primary health care, home care, and so on. Here are what the federal, provincial, territorial ministers called other priority areas, things like patient safety, health, human resources, and then performance indicators, a couple of examples being timely access or waiting lists and quality, and then you'll see also a category for Aboriginal health. The number in brackets refers to the number of documents. So 521 means there are 521 documents related to national priority areas. If I only want documents related to primary care, I would only tick that document. If I wanted all documents related to all national priority areas, I would tick the bigger box to the left. But I'm primarily interested in primary care. I can then choose my jurisdiction. I can either pick federal or national documents, or I can click any province or territory. So I can pick federal or national. If I wanted to pick more than one, I could hold down the Control key while I pick the other document. But for now, I'll only take federal or national. And then here are the types of documents. So there are 25 in total. And I mentioned the new edition, which I didn't realize we hadn't yet added documents for. It's brand new, so we'll be adding them very shortly. This is where they would appear. If I tick that, I would receive information about political party platforms. So if I were to now, having picked primary care, click on search, you'll see that Canadian healthcare renewal documents have lit up. So 164 of them. I'll show you in a second how I could have done a broader search within health systems evidence, but for now I only looked for Canadian healthcare renewal documents. If I click on those, I get a listing of them. So from innovation to action, the first report of the Healthcare Innovation Working Group. So it tells me the title of the document. It also tells me whether the document is of general relation to the topic of primary care or very specifically focused. It reminds me that it's a Canadian healthcare renewal document. It tells me it was published in 2012. It tells me there's no rating tool available for this type of document, so we can't comment on its quality. Its focus is Canada, whereas had I picked Saskatchewan or Alberta, it would show the province or territory that I was speaking about. And here I'll show you how you can show links, or I can create a one-pager. But if I start with showing links, if I click on that, there's no user-friendly summary of that particular report, no document summary of any type, in fact, but there is a full text report. So if I click on that, I'll be taken directly to that document. If I'm, though, interested in that topic area, but want to know is there any research evidence, say about the effectiveness of a particular primary care reform, I could click on these links and be brought to the relevant research evidence from health systems evidence. If this document is exactly what I'm looking for and I want to share it with a colleague, I can click Create, which creates a one-page summary of the document, the title, the type of document, the priority areas that it covers, the health system topics it covers, the domains it covers. You can see this is a topic that is very broad. It talks about many, many issues. The year it was published, the country focus, the full text, the link to the full text report, the citation, so I can cut and paste it into a briefing note, and the links, I come to this page. So I can go to the URL and save that URL and copy and paste it into a document and send it to my colleague so he or she can access the same information about the document, including the direct link. If I were to go back to this page, what was the other thing that I was going to show you? I guess the other thing was the search from health systems evidence. So if I come back to health systems evidence, tick on the EIHR portal, and let's say that I would like to focus specifically on documents that have to do with optimal aging and that have to do with how primary health care can support optimal aging and keep the focus on federal national. So now I'm using 3 different search terms, and so you'll see 24 lit up. Sorry, I didn't get any non-health systems evidence documents. Let me go back for 1 second. Let me remove the focus on primary care from here. If I run the search again, so I'm focused on optimal aging, Only ended up with 56 documents. I must have some button pushed somewhere that is causing a problem. Optimal aging is ticked. I don't see any of these being, oh, federal national is ticked. So let me try and get rid of this. Or let me grab them all. That should give me more there. So now I've got more documents. So because, oh no, I don't. Sorry, I'm still back to Canadian EIHR documents. I won't waste any more time, but there are, if I must be doing something wrong, but normally what would happen if I searched health systems evidence as well, some of these documents would light up. So if I wanted to see a systematic review, I could go directly to those. So sorry to end on a bummer note that I obviously have some glitch in my search. It's not the system, it's me, unfortunately. But that's essentially the EIHR portal in a nutshell. So rather than take up any more time, if I could, Chad, go back to the slide deck.
Sure, for that you can click the return button at the top. It should say floating desktop.
There we go. Great. Thank you. So that's the quick summary of the EIHR portal. So if you'd like to access it, you can go to eihrportal.org. If you want to learn more, I mentioned before the two-page backbander. It gives you a quick, in a nutshell, view of the portal, and you can also watch a 5-minute video about the EIHR. If you have any questions about the EIHR Roundtable, you can contact Jennifer Campbell, who spoke earlier. If you have any questions or comments for us, for example, you're having trouble using the portal or you have a document that you think should have been present that wasn't, we'd be very happy to consider it for inclusion. You can send an email to hse@mcmaster.ca. And we're starting to ramp up a Twitter service that will bring to attention highly salient new documents added to each EIHR, in which case you can find us on Twitter to sign up for that. So any questions or comments?
So feel free to raise your hand if you would like to bring your questions forward verbally, or you can also chat your questions in the chat button. Do we have any questions for John?
While we're waiting to see if folks have questions, Jennifer, do you, is there anything that I missed in going through that you think would be particularly important to highlight?
John, I think you did a great job covering it, and I think going through the overview and the walkthrough was fabulous. So thank you for that. I don't have anything in particular to add. Hopefully we get a few questions, and hopefully, again, people that hadn't signed up for the EIHR portal yet and signed up for that customized service will take the time to do that. I think they'll find it extremely valuable.
Thanks.
So we do have questions that came up. So one of them is from Julie, which is asking, how do you select the documents for inclusion in the portal?
Yep. So great question. I should have covered that. So thank you, Julie, for reminding me. So we have two mechanisms. So one is the 19 organizations that are active members of the portal initiative, so EIHR Roundtable members. They have the opportunity every month to refer documents to us. So if, for example, one of the participating ministries of health or, say, the Canadian Nurses Association either produces a document themselves or comes across a document that they think is highly relevant, they send it in to us, and then we assess it for inclusion. So as long as it addresses healthcare renewal in Canada, then typically it would meet our criteria and we add it to the portal. The other thing is that Carolina, who I mentioned before, who's on the call, Carolina every month is regularly searching a wide variety of different sources and adding documents. So an example would be there is a weekly email, which I believe is called Health Edition, that comes out, I think it's every Friday, that contains links to a number of documents in Canada. So we routinely go through that, and if there's any healthcare renewal related documents, they're pulled in. So it's a combination of referrals from the 19 organizations that have played a leadership role in establishing the portal, and our own mechanisms of constantly trying to identify these documents every month.
Thank you. And another question from Susan. Can the documents be downloaded for free?
Yes, so every document is available for free, and I think, as I mentioned before, I believe every single document in the EIHR portal has free full text available. So when you come to a document that is of interest, if you click on Show Links, that will take you immediately to the link to the full text document. It's also the case that if you create a one-pager, as I showed you how to do, it will also have the link there. So every document in the EIHR portal has a link directly to the full text report, and they're all available for free.
Thank you. Marina is wondering if it is possible to export results to citation management software like EndNote.
That's another great question. So the answer is for now, no. It is something that we have on our wish list that we'd like to look at in future. It's much less an issue for the EIHR portal, which than it is for for health systems evidence more generally. We have had some difficulty in the past with health systems evidence with individuals in other countries stripping the database and then presenting it to funders as their own work. So we currently have a limit on the maximum number of records that can be shown from a search of health systems evidence set at 50. And so if we were to put in place an export function, we'd have to grapple with the issue for the rest of HSE about whether we would let people export the entire database. For the EIHR portal, where the partners are fundamentally committed to make sure that all of these documents are used, there wouldn't be the same concern about people downloading the entire database. So it is on our wish list to add the export function. It just isn't something that until at least the present we've had the resources to do, but it is on our wish list.
Excellent. Andrew has a question. Do contributors make a concerted effort to proactively and continuously provide the most updated information? Or does it require a certain level of prompting on the part of EIHR staff?
So I think it does require some prompting. There is a designated point person. Jennifer, put in place a very rigorous process with these organizations. Each organization has a point person who should be thinking about this, but we have a reminder system built in, so they're regularly prompted, and they know what the cutoff deadline every month is, so that if we get it by a certain day of the month, then we're able to ensure that we include it in that month's evidence service. So it's a combination of having an individual in each of those 19 organizations know it's their responsibility once a month to ask the question, is there anything new that we need to get into the portal? But we do prompt them. And as I mentioned before, we also, or at least Carolina, goes through a very extensive process of trying to find these documents on her own through a variety of listservs that she and some of us are signed up for. So we think that through the combination of strategies, we're doing a very, very good job of keeping up to date with all new documents as they come out.
Okay. So do we have any other questions that we'd like to bring forward?
And I think someone had asked there, Chad, that would the presentation be made available, and it will be on the CIHR website. We'll circulate it afterwards so that you have access.
And the other thing that I should mention is that I think 30 minutes after this webinar ends, my colleague François Gauvin, who's on this, listening in on this webinar, will be running another webinar in French. So if you have any Francophone colleagues who you think might benefit from the webinar, that will be starting in 30 minutes after the end of this webinar. And that will also be posted on the CIHR website, the French version of this document.
We have another question. Susan is asking, how can other organizations make their toolkit available?
So you're welcome at any time to suggest documents. You don't need to go through any of the participating partners. So if you have documents that you think would be relevant to the portal, then you can just send them to the email address hse@mcmaster.ca. So hse@mcmaster.ca. And that email address was earlier in the slide deck. And then what will happen is our team will assess its eligibility, but provided it has to do with supporting healthcare renewal in Canada, there's an excellent chance that it would be considered eligible. I should have said at the beginning that we have a very rigorous process for both eligibility assessments and coding the documents to make sure that when people search, they're finding what they need. So that's done independently by 2 raters who then make sure that they come to consensus about eligibility and coding. And there was another point that I was going to make, which just popped out of my head. It had something to do with referrals, but anyway, it's gone. So we warmly welcome people's suggestions. We don't get many coming in through that way, but we're delighted to deal with them when they do come in.
So I think we have one final question from Gail. Once I've created the one-page summary and sent the link to my colleagues, do they need to be registered to access it?
No. So if you've sent a link to somebody, then that one pager will continue to function. However, if you were to, say, click on a link to see all systematic reviews related to that document, then it will bring you to a page where you do need to log in. But if you're only sharing the link, the one document, then they don't need to be registered in Health Systems Evidence. So the only reason why you'd need to register is if they're accessing the related resources. So they want to see, say, all systematic reviews. And the reason is that has to generate a new request to the database. And so for that, you need to be logged in.
Okay, thank you. So for the last words, I will pass the mic to Jennifer.
Okay, and thanks everyone. Thank you, John, for going through the EIHR portal. And just to end by encouraging all of you, if there are documents that you feel should be in the portal, to use the hse@mcmaster.ca and submit them. If you have suggestions for the site itself, please don't hesitate to forward them also to the hse@mcmaster.ca or myself. We're always looking to continue to improve the site and make sure that it is accessible and easy to use as possible. So I just want to thank all of you and just encourage you to sign up for the EIHR portal if you haven't already done so. And thank you very much to John. Have a great day.
Thank you, everyone.